In your morning medical news, popular GLP-1 drugs have long been approved to help treat type 2 diabetes. But a new study suggests the use of these drugs has significantly increased among children and adults with type 1 version of the disease. And researchers say the medicine may not be safe for them. Mandy Gaither talks to the study's senior author about what patients should know.
It's a less common kind of diabetes where the pancreas doesn't make enough insulin. Around 2 million Americans are affected by type 1 diabetes, and while it was once thought of as a thin person disease, that doesn't appear to be the case anymore.
Their obesity rate also may be increasing just as other like a general population.
Because of that, Johns Hopkins researcher Dr. Jung M. Shin says an increasing number of adult and pediatric patients with type 1 diabetes are going on some GLP-1 medications, which right now are only FDA approved for type 2 diabetes and those who have obesity.
That kind of medication can be as effective as for type 1 diabetes population, but we don't have data.
Shin says the concern is that those with type 1 diabetes who depend on daily insulin and use GLP-1 medications at the same time will be at an increased risk of hypoglycemia, dangerously low blood sugar levels, and ketoacidosis, where acidic substances build up in the blood.
We don't know whether this is effective or safe in this population.
Shin and her team's latest research says there could be some health benefits for these drugs in the type 1 diabetes population, but they're calling for clinical trials to further study this and develop clear guidelines for these patients.
The scientists are now following up with a narrower study on type 1 diabetes patients, seeing how much of a risk there is for hypoglycemia when it comes to the use of GLP-1 drugs.